The fellowship is important to my NHS practice because it's shed light on really important and pertinent topics within the NHS, in particular cultural diversity and understanding cultural diversity and understanding health and equality.
Yesterday I was in clinic in the NHS and there was a patient that really needed a tympanogram, which is a very simple hearing test. There wasn't an audiologist available to do it, but I was able just to borrow a tympanometer and do the hearing test myself, and I wouldn't have been able to do that if it hadn't been for learning that skill on the job in the ear camps.
I feel like I'm ahead of my training because by working with the senior registrar and with the lab, both in Uganda and with Kenya, I've learned so much. I already feel like I know more compared to my colleagues at this stage of training, so it's been really beneficial.
When I started working for the NHS, I thought that I'm going to be this little voice that you probably wouldn't hear speaking, but because of the interaction with mentors, with colleagues in other countries as well, it made me more confident. It allowed me to speak up, be involved in the decision making.
I learned about a different culture and I learned about how different healthcare system works. And I think that's very important because it makes you appreciate what background people have and what challenges they might face and how this can be different to your own experience. And I think that's very transferable to the NHS.
Well, it's been an incredibly humbling experience to work abroad and undertake the observership I did during the visit. When I was undertaking the visit, we didn't have readily available computers to look at scans such as X-rays and CT scans, and we were looking at plain films. That's something that I realized that we take for granted a lot of the time, and actually utilizing the skills that we have from medical school and seeing how they apply those skills there abroad.
One of them is how much they reuse equipment, because obviously they don't have the resources that we have. Even ear speculums that we use for otoscopes, they wash them and reuse them. And it just makes you think a bit more about the waste that we have in the NHS.
Working in Uganda, it opened my eyes to how resilient they could be, how adaptable they could be. And that's despite of the complexity that they are in, despite the resources that they have. And reflecting back on that, moving back to the NHS, this time I'm coming in refreshed and living again what the true definition of nursing is, which is altruism, selfless concern for others, things like that.
Despite all the differences there are in healthcare systems, the most important thing to make sustained, impactful change is interpersonal relations, developing partnerships for meaningful change throughout the NHS and global health work. That's what it's about for me.